everybody. Today's topic of my video is viral gastroenteritis. Each year millions of people around the world die because of this, especially children under 5 years of age. So this is very important to know the reasons and how you can prevent it. So let's discuss the viral gastroenteritis. This is an intestinal infection marked by watery diarrhea, abdominal cramps, nausea or vomiting, and sometimes fever. The most common way to develop viral gastroenteritis, often called stomach flu, is through contact with an infected person or by ingesting contaminated food or water. If you are otherwise healthy, you will likely recover without complication. But for infants, older adults, and people with compromised immune systems, viral gastroenteritis can be deadly. There is no effective treatment for viral gastroenteritis, so prevention is the key. In addition to avoiding food and water that may be contaminated, thorough and frequent hand washing are best defense of yours. Coming to the symptoms of viral gastroenteritis, this is commonly called stomach flu, and this is not the same as influenza. Real flu, which is known as influenza, it affects only your respiratory system, your nose, throat and lungs. On the other hand, gastroenteritis attacks your intestine, causing signs and symptoms such as watery, usually non-bloody diarrhea. Bloody diarrhea usually means you have a different, more severe infection. So, as I just said, that normally the diarrhea which happens in viral gastroenteritis is non-bloody. The second symptom, which is most commonly encountered, is abdominal cramps and pain, nausea, vomiting, or both. Then there is the occasional headache or muscle aches and low-grade fever. Now, depending on the cause, viral gastroenteritis symptoms may appear within 1 to 3 days after you are infected, and they can range from mild to severe. Symptoms usually last just a day or two, but occasionally they may persist as long as 10 days. Because the symptoms are similar, it is easy to confuse viral diarrhea with diarrhea caused by bacteria such as Clostridium difficile, Salmonella, and E. coli, or parasites such as Giardia. Now let me tell you when you should see a doctor. First of all, if you are not able to keep liquids down for 24 hours, you have been vomiting for more than 2 days, you are vomiting blood, or you are dehydrated. There are signs of dehydration which include excessive thirst, dry mouth, deep yellow urine, or little or absolutely no urine, and severe weakness. You can suffer from dizziness or lightheadedness. So these are the alarming symptoms. Also, you can notice blood in your bowel movements, and if you have a fever above 104 degree Fahrenheit or 40 degree centigrade. As I just mentioned before, that if there is a blood in your stools, it means there could be a super added bacterial infection. Okay. For infants and children, it can be more dangerous, and you should immediately contact doctor if your child has a fever of 102 Fahrenheit or 38.9 degrees centigrade or higher. If he or she seems lethargic or very irritable, or he is in a lot of discomfort or pain, has bloody diarrhea, which means there could be a superadded infection, or he or she seems dehydrated, you should watch for the signs of dehydration in very sick infants and children by comparing how much they drink and urinate with how much is normal for them. If you have an infant, remember that while spitting up may be an everyday occurrence for your baby, vomiting is not. Babies vomit for a variety of reasons, many of which may require medical attention. You should call your baby's doctor right away if your baby has vomiting that lasts more than several hours, he has not had a wet diaper in 6 hours, has bloody stool or severe diarrhea, has a sunken soft spot, frontanel on the top of his or her head, has a dry mouth or cries without tears. It means that he or she is dehydrated too much, that there are no tears also. Or if he or she is unusually sleepy, drowsy or unresponsive. So in these conditions, you should immediately call your child's doctor. Now let's discuss some of the causes of viral gastroenteritis. You are most likely to contract viral gastroenteritis when you eat or drink contaminated food or water, as I just mentioned, or if you share utensils, towels, or food with someone who is already infected. A number of viruses can cause gastroenteritis, which include noroviruses. Both children and adults are affected by noroviruses, the most common cause of foodborne illness worldwide. Norovirus infection can sweep through families and communities. It is especially likely to spread among people in confined spaces. In most cases, you pick up the virus from contaminated food or water, although person-to-person transmission also is possible. Second comes rotavirus. Worldwide, this is the most common cause of viral gastroenteritis in children, who are usually infected when they put their fingers or other objects contaminated with the virus into their mouths. The infection is most severe in infants and young children. Adults infected with rotavirus may not have symptoms, but they can still spread the illness. A particular concern in institutional setting because infected adults unknowingly can pass the virus to others. A vaccine against viral gastroenteritis is available in some countries, including USA, and appears to be effective in preventing the infection. I am talking about vaccine against rotavirus. Now here one thing you should note also that some shellfish, especially raw or uncooked oyster, also can make you sick. Although contaminated drinking water is the cause of viral diarrhea, in many cases the virus is passed through the fecal-oral route. That is, someone with a virus handles food you eat without washing his or her hands after using the toilet. Now let's discuss some of the risk factors. As I mentioned before, this gastroenteritis occurs all over the world, affecting people of every age, race, and background. People who may be more susceptible to gastroenteritis include young children. These children in childcare center or elementary school may be especially vulnerable because it takes time for a child's immune system to mature. And older adults have immune system which are less efficient later in their lives. So older adults in nursing homes in particular are vulnerable because their immune system weaken and they live in close contact with others who may pass along germs. Next come the school children, church goers, or dormitory residents. Anywhere that groups of people come together in close quarter can be an environment for an intestinal infection to get past. And anyone with a weakened immune system, if your resistance to infection is low, for instance, if your immune system is compromised by HIV, AIDS, chemotherapy, or another medical condition, for example cancer, you may be especially at risk. Each gastrointestinal virus has a season when it is most active. If you live in the northern hemisphere, for instance, you are more likely to have rotavirus or norovirus infection between October and April. Now let's throw some light on the complication. The main complication of viral gastroenteritis is dehydration, that is a severe loss of water and essential salts and minerals from your body. If you are healthy and drink enough to replace fluids you lose from vomiting and diarrhea, dehydration should not be a problem. Infants older adults and people with suppressed immune system may become severely dehydrated when they lose more fluids than they can replace. Hospitalization might be needed so that lost fluids can be replaced intravenously. Dehydration can be fatal, but rarely. Now let's discuss some of the preventive measures. The best way to prevent the spread of intestinal infection is to follow these precautions which I am going to tell you now. First of all, get your child vaccinated. A vaccine against gastroenteritis caused by rotavirus is available in some countries, including the United States. Given to children in the first year of life, the vaccine appears to be effective in preventing severe symptoms of this illness. Second, most important is that you should wash your hands thoroughly and make sure your children do. Also, if your children are older, teach them to wash their hands, especially after using the toilet. It is best to use warm water and soap and to rub hands vigorously for at least 20 seconds, remembering to wash around cuticles, beneath fingernails, and in the creases of the hand. Then rinse thoroughly. Carry sanitizing wipes and hand sanitizer for times when soap and water are not available. The third prevention is that you should avoid sharing eating utensils, drinking glasses, and plates. You should use separate towels in the bathroom. Next is that you should keep your distance. Avoid close contact with anyone who has the virus if possible. And you should disinfect hard surfaces. If someone in your home has viral gastroenteritis, disinfect hard surfaces such as counters, faucets, and door knobs with a mixture of 2 cups of bleach to 1 gallon of water. And then you should check out your childcare center. Make sure that center has separate rooms for changing diapers and preparing or serving food. The room with the diaper changing table should have a sink as well as a sanitary way to dispose of diapers. Now let me tell you some precautions when traveling. When you are traveling in another country, you can become sick from contaminated food or water. You may be able to reduce your risk by following some of the tips. Number 1 is that you should drink only well-sealed bottled or carbonated water. You should avoid ice cubes because they may be made from contaminated water. Use bottled water even to brush your teeth. Avoid raw food, including peeled fruits, raw vegetables, and salads that has been touched by human hands. You should also avoid undercooked meat and fish. Coming to the diagnosis of this illness, your doctor will likely diagnose gastroenteritis based on symptoms, a physical exam, and sometimes on the presence of similar cases in your community. A rapid stool test can detect rotavirus or norovirus, but there are no quick tests for other viruses that cause gastroenteritis. In some cases, your doctor may have you submit a stool sample to rule out a possible bacterial or parasitic infections. Now let me tell you treatment options. Well, there is often no specific medical treatment for viral gastroenteritis. Antibiotics are not effective against viruses, and overusing them can contribute to the development of antibiotic-resistant strains of bacteria. So the treatment initially consists of self-care measures. So here are some lifestyle and home remedies. To help keep yourself more comfortable and prevent dehydration while you recover, try the following. First of all, let your stomach settle. Stop eating solid food for a few hours. Secondly, try sucking on ice chips or taking small sips of water. You might also try drinking clear soda, clear broth, or non-caffeinated sports drinks. Drink plenty of liquids every day, taking small frequent sips. Thirdly, you should ease back into eating. Gradually begin to eat bland, easy to digest foods such as soda crackers, toast, gelatin, bananas, rice, and chicken. Stop eating if you if your nausea returns. Third thing is you should avoid certain foods and substances until you feel better. These include dairy products, caffeine, alcohol, nicotine, and fatty or highly seasoned foods. Get plenty of rest. The illness and dehydration may have made you weak and tired. You should be cautious with medication. Using many medications such as ibuprofen sparingly, if at all. Normally what happens, for example, if you are suffering from other illness, for example, if you have back pain, joint problem, normally some people take this painkiller, we call them non-steroidal anti-inflammatory drugs such as brufen. So if you develop this viral gastroenteritis, it's better if you can tolerate, then you should avoid these kind of drugs because they may aggravate your stomach symptoms. Even you should use acetaminophen, that is Tylenols, cautiously. It sometimes can cause liver toxicity, especially in children. Do not give aspirin to children or teens because of the risk of Reeves syndrome, a rare but potentially fatal disease. Before choosing a pain reliever or fever reduces, discuss with your children's pediatrician. Now let's come to the treatment for infants and children. When your child has an intestinal infection, the most important goal is to replace lost fluids and salts. For example, I give you some suggestions. First of all, help your child rehydrate. Give your child an oral rehydration solution available at pharmacies without a prescription. Talk to your doctor if you have questions about how to use it. Do not give your child plain water because in children with gastroenteritis, plain water is not absorbed well and it won't adequately replace lost electrolytes. Avoid giving your child apple juice for rehydration. It can make diarrhea worse. Secondly, get your child back to a normal diet slowly. You should gradually introduce bland, easy to digest food such as toast, rice, bananas, and potatoes. Also, you should avoid certain food. For example, you should not give your child dairy products or sugary foods such as ice cream, sodas, and candy. These can make diarrhea worse. Next is that you should make sure your child gets plenty of rest. The illness and dehydration may have made your child weak and tired, so he or she should get plenty of rest. Next is that you should avoid giving your child over-the-counter anti-diarrheal medication. Unless advised by your doctor, they can make it harder for your child's body to eliminate the virus. If you have a sick infant, let your baby's stomach rest for 15 to 20 minutes after vomiting or a bout of the diarrhea. Then offer small amounts of liquid. If you are breastfeeding, let your baby nurse. If your baby is bottle fed, offer a small amount of an oral rehydrate solution or regular formula. Do not dilute your baby's already prepared formula. I hope you like this video of mine. It's very important to prevent against viral gastroenteritis and the consequences which I told you in this video. If you are suffering from any other illness, please post your comments in the comment section of this video, and if you like this video, please share with your friends. Until now, if you have not subscribed this channel, please subscribe it and click the bell icon and select the all option for the upcoming videos. Thank you very much.